to allow for a comfortable assessment of the airway by the provider. Align the ear canal with the sternal notch. Place the patient in a sniffing position by slightly extending the neck. Scissor the mouth widely open with the right thumb and index finger. Holding the laryngoscopy blade in the left hand, insert the tip of the blade at the right corner of the mouth. Advance the blade along the lingual surface of the right mandibular molar teeth. Sweep the tongue to the left side of the mouth. Use caution when advancing the laryngoscope blade to prevent injury to the teeth and to prevent entrapment of the lip or tongue. With the curved blade, advance while identifying structures until the tip of the blade is in the vallecula. Then lift the handle to expose the glottis. Insert the endotracheal tube into the glottic opening and through the vocal cords. Inflate the cuff and confirm placement.
Intubation. It's a critical intervention, often a life-saving procedure in emergency medicine. It serves as a bridge between compromised breathing and the restoration of a vital life force, air. When a patient cannot breathe on their own, intubation ensures that oxygen can still reach their lungs. Intubation involves inserting an endotracheal tube through the mouth into the trachea, creating a secure airway for assisted ventilation. This tube is carefully positioned to ensure that air can flow freely into the lungs. Imagine a patient arriving at the hospital struggling for each breath, their oxygen levels plummeting. The medical team must act swiftly to stabilize the patient. This is where intubation steps in, a beacon of hope in a critical situation. The procedure can be the difference between life and death, providing the necessary support until the underlying issue can be treated. It's performed in emergency rooms, operating rooms, and critical care units worldwide, a testament to its life-saving potential. Whether it's a trauma patient, someone undergoing major surgery, or a critically ill individual in the ICU, intubation is a cornerstone of modern medical care. Join us as we delve into the intricacies of intubation, exploring the steps involved, the equipment used, and the critical importance of adhering to medical protocols. Understanding this procedure not only highlights the skill and precision required, but also underscores the profound impact it has on patient outcomes. Before intubation, meticulous preparation is paramount. This involves gathering necessary equipment, ensuring a sterile field, and preparing the patient both physically and psychologically. Patient positioning is crucial. Typically, the patient is placed in the sniffing position to optimize visualization of the vocal cords. Adequate lighting is essential for clear identification of anatomical landmarks. An intubation kit, including various sizes of endotracheal tubes, a laryngoscope, a stylet, and a syringe, is assembled. Psychological preparation of the patient, with clear explanations and reassurance, can alleviate anxiety and foster trust. This human connection can make a significant difference in the overall experience. Intubation requires specialized tools, each meticulously designed for a specific purpose. Each piece of equipment plays a crucial role in securing the airway and ensuring the patient's safety during the procedure. The laryngoscope, resembling a small curved flashlight, is used to expose the vocal cords, providing a clear view for the insertion of the endotracheal tube. The endotracheal tube, a flexible, transparent tube, is chosen based on the patient's age, size, and anatomy. It serves as the conduit for air to reach the lungs. A cuff near the tube's end is inflated to create a seal within the trachea, preventing air leakage and aspiration of fluids into the lungs, which is critical for patient safety. A stylet, a stiff but flexible wire, provides temporary rigidity to the endotracheal tube during insertion, aiding in navigating the airway and ensuring proper placement. Other essential equipment includes a suction catheter, which clears secretions, a bag valve mask, BVM, for manual ventilation, and a pulse oximeter to monitor oxygen levels in the blood. Understanding the function and proper use of each instrument is paramount for any healthcare professional involved in this life-saving procedure. Mastery of these tools ensures the highest standard of care and patient safety during intubation. Pre-intubation checks are essential to ensure patient safety and optimize success. These checks are a series of steps that medical professionals must follow meticulously to prepare for the intubation process. Verifying patient identity is crucial to avoid potentially life-threatening errors. This step involves cross-referencing the patient's wristband with their medical records to ensure that the right patient is being treated. A thorough assessment of the airway, including the Mallampati score, guides decision-making. This assessment helps in predicting the difficulty of intubation and planning the appropriate approach. Equipment checks ensure the laryngoscope functions properly, the endotracheal tube is available, and the suction apparatus is adequate. Each piece of equipment must be in perfect working order to avoid complications during the procedure. The BVM should be connected to an oxygen source and checked for leaks. Ensuring the BVM is functional and leak-free is vital for maintaining the patient's oxygenation during the intubation process. Medication preparation, including sedatives and paralytics, should be done in advance. These medications are essential for patient comfort and to facilitate a smooth intubation process. These checks are critical steps that can mean the difference between a life saved and a life-threatening complication. Proper communication among the medical team ensures that everyone is aware of their roles and responsibilities. Ensuring all these elements are in place sets the stage for a successful intubation. A well-prepared team and thoroughly checked equipment can significantly increase the chances of a positive outcome for the patient. With preparation complete, the intubation procedure can commence. Pre-oxygenating the patient with 100% oxygen creates a vital reserve for the brief period of apnea during tube placement. The patient is positioned and the laryngoscope is used to visualize the vocal cords. The endotracheal tube is carefully advanced through the vocal cords into the trachea. The stylet is removed and the tube's cuff is inflated to create a seal. The tube is connected to a capnography device to confirm proper placement by detecting exhaled carbon dioxide. Each step requires precision, expertise, and a steady hand. Confirmation is key. Verifying tube placement is critical. Capnography measures the concentration of carbon dioxide in exhaled breath, confirming correct placement. Auscultation, listening to breath sounds with a stethoscope, ensures clear and equal breath sounds over both lungs. Chest X-ray provides definitive confirmation of tube placement. Visualizing the tube passing through the vocal cords during insertion provides initial reassurance. However, subsequent confirmation with capnography, auscultation, and chest X-ray is essential. Ensuring the tube is correctly positioned avoids potentially life-threatening complications. Securing the airway tube fixation is paramount. Securing the tube prevents accidental dislodgement, ensuring stability and effective ventilation. Tube fixation involves using adhesive tape or a commercial tube holder device. The choice of fixation method depends on factors such as the patient's age and skin condition. Regular assessment of the tube security is essential to prevent accidental extubation. The fixation device should be inspected for any loosening or detachment. Ensuring the tube is secure allows for safe and effective ventilation. Post-intubation care is crucial for maintaining airway patency and monitoring for complications. Continuous monitoring of vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation, is essential. Regular assessment of tube placement and security is paramount to prevent accidental extubation. Oral care is crucial for preventing ventilator-associated pneumonia. Pain management and sedation are essential for patient comfort and to prevent agitation. The level of sedation should be balanced to achieve comfort and airway protection. Post-intubation care focuses on maintaining airway patency, ensuring adequate ventilation and monitoring for potential complications. Mastering intubation, a life-saving skill. Intubation is a complex procedure requiring knowledge, skill, and judgment. It demands a deep understanding of airway anatomy and meticulous attention to detail. Mastering intubation requires ongoing education, practice, and teamwork. Simulation training provides a safe environment to hone skills and build confidence. Intubation is a team effort requiring seamless coordination and communication among healthcare professionals. By embracing knowledge, skill, and compassion, we can strive to master this life-saving skill and provide the best possible care for our patients.